Thank you, everyone, for being patient.
No problem.
Thank you. Good
Thank you.
afternoon. I'm going to call this meeting to order at 4:35 p.m. And I'm going to read the governor's order. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, general law, chapter 30A, section 18, this meeting of the Dudley Board of Health will be conducted in total via remote participation. Specific information and general guidelines for remote participation by the members of the public and or the parties with the right or requirement to attend this meeting can be found on the Town of Dudley's website at dudleyma.gov. For this meeting, members of the public who wish to watch the meeting may do so in the following manner: via YouTube, posted at the link at dudleyma.gov. And any voting that we do tonight must be done with a roll call vote. Okay. So I'm going to call the meeting to order. Our first item on the agenda is item number 1, 5 to 7 Brandon Road. And we have Attorney Veglia here.
Yes,
Good afternoon.
good afternoon.
We have been informed that 5 Brandon Road has been in touch with the Town of Dudley Sewer Department. And the sewer superintendent, oh, go ahead, Jamie, sorry.
I apologize. I don't know if you want to frame it all the way back from where the scenario started. I don't mind doing that if you want me to.
Yeah, if you don't mind, please. Thank
Sure.
you.
Upon starting in town, the property owner of the vacant lot, I'm sorry, I don't know how to say your last name, Joe, appropriately.
That's okay.
Do you want to?
It's Waskevich.
Thank you, Waskevich.
Yeah.
Mr. Waskevich gave me a call, or gave our office a call at the Board of Health office, and stated that there was discharge of some sort coming out onto his vacant property. He wanted me to go out with him and investigate it. I did such on a Saturday in October. We did evaluate and find, in fact, it was raw sewage that was discharging to ground surface at that time. It was believed by Mr. Waskevich. Did I say it right?
Yes,
Okay.
Use the word Joe is fine.
Okay. I really have tried and I never can get it right. So that,
Don't worry about it.
so anyway, that there's a possibility that it was coming from 5 Brandon Road, which is the property next door, abutting this property that does have a home on it. In further investigation, that is in fact the case. It is a cesspool on the vacant lot owned by Joseph, and it appears that we've proven now that 5 Brandon Road is the discharging house that does flow that cesspool onto that property. It should also go noted that the owner at 5 Brandon Road was unaware of this scenario, that when they purchased the property, they believe they were being billed for a sewer line and sewer services through the Town of Dudley, and they believed that they were serviced through a sewer line. Which actually, in fact, when we were there, we were wondering if it was a breach in the sewer line that was running, through the road all the way down, through the property all the way down to Chase Ave, or if it was in fact, I guess what it was, a cesspool. So after that time period, you'll recall this matter came before you as a board, and we did issue an order at your direction for 5 Brandon Road to immediately address the imminent health hazard and find a permanent solution to rectify where the discharge of effluent can appropriately go under the order of Title V in the Environmental Code for Massachusetts. Since that time, both parties have hired an attorney and have tried to work on the matter. I know that the property owner at 5 Brandon Road did hire Slims and Berthium to come out and pump that cesspool and try to evaluate what it was and what it looked like. I guess that's how we know it's a cesspool. I was not out there, so I can just say that there was some discussion that additional pumping could have occurred from what originally was, what started pumping that day. They could have gone and gotten another truck and come back and pumped it additionally And the conversation that I understand it was that Joseph asked them not to come back onto the property. Certainly he can give us that information himself tonight, but that's as I understand it. Because my direction is that no matter, I understand that they're evaluating and assessing and trying to move forward with a fix, but they need to maintain that that system without the imminent health hazard of discharging a ground surface. Since that time, I've been in contact with the attorney from Mr. Benavides, the owner at 5 Brandon Road, weekly, and told them that if they're not going to be able to move forward with an easement on either Mr. Wachowski's property or the property next door, which is to the vacant lot, is a condo complex, and they've also been exploring possibilities of trying to run an easement down that property into the sewer line. And if neither one of those are going to become feasible for whatever reason, they needed to hire an engineer and conduct soil testing on their own property so that they could put a septic system on their own property and move forward from this scenario. An engineer did call me last week, finally. He is from the South Shore. I don't know him. His name is Dan Aguiar. He actually has brought a proposal forth to tie in 5 Brandon Road in the main road of Brandon Road down to Chase Ave to actually connect it into the sewer line. And so we connected this week, 2 days ago, and I got him in touch with the sewer department. And that's where, if you'd like Ms. Canoia to take it from there.
Sure, thank you. Yes, we were notified that the superintendent of the sewer department has spoken with the engineer and is working as quick as possible to come up with a solution of how it will be run to get it to connect to the town sewer.
And you were told that the water sewer superintendent believes that it is feasible to connect in Brandon Road to that sewer main so that it would rectify the problem.
That is correct. He told me they were able to run it down Brandon Road to Chase. Yes.
With like an E1 ejector pump or something to that effect.
Yeah, something to that effect. Yes.
Okay. Thank you.
No problem. Any board members have any questions before we go on to Attorney Veglia, excuse me. No. Attorney Veglia?
Well, obviously you told me more in the past 5 minutes than I've heard in the last 3 months. Simply stated. So we have never been told there's an engineer involved. When I questioned the other party about installing a septic system on his own property or contacting another owner about a different easement over a different piece of property, I was told that I shouldn't keep telling him what to do. So our issue is quite simple. This property needs, every single day, and I was not being facetious when I put in a letter that I think the Board of Health agent has a copy of, that every time the tap turns on or the toilet flushes at 5 Brandon Road, it ends up on my client's property. We have always asked for a permanent solution, not a temporary solution. And the first go round about pumping the fluids, yes, they did pump the fluids. So they were down to solids. And there was no discussion about pumping more fluid because they had taken all the fluid out of it on November 11th. And not less than a month later, it was back up full, flowing over the sides of the hole that was created. And those were the pictures that I sent the Board of Health. Those were taken December 18th. I think I also sent you a plan today to make it clear that Mr. Benavides does have his own property on which he can construct a septic system. So there is more than one solution here. It's just that nothing has been done. No affirmative action has been taken for the last 3 months since the order was issued by the Board of Health on October 30th. So if he's not going to make it a permanent solution, and I mean post haste, then he needs a pump truck there every single day to pump out exactly what he is dumping on my client's property, and he should be cited for the continuing violation. It's not only raw sewage that is flowing directly onto the property, but they're biohazardous materials. And I mentioned that in the letter, December 18th.
Attorney
So
Bigelow, if you don't mind, if I ask you a question, do we have permission to tell them, the owners at 5 Brandon Road, that they can have a pump truck on site to have that pumped down? I just want to make sure that we have permission from the owner of the property, or that they have permission, I guess is the better way to say it, because I want that to be clear that they told me that the company that was pumping it down was going to come back and break up those solids to try to give more space in that cesspool, so that it would be at least not breaking out to ground surface while they tried to rectify it.
But it's still a cesspool, it's still a violation, and it's still a temporary solution. Are they going to have a pump truck there every day?
I don't disagree with you that that's a temporary fix. However, that is a measure that can handle the imminent health hazard on hand. I am agreeing with you that they need to push it forward. I've told them that they hired an engineer. The engineer has gotten in contact with me. I've made it explicitly clear that they need to take action, and it needs to be in expedited fashion as well. But I would like the imminent health hazard to be addressed in the meantime, which is why I mandated them to pump it before. And I guess I'm asking, can they have access to pump it again?
Well, the last time they showed up, they knew that my client was supposed to be notified and be on site at the time the pump truck came. That didn't happen, even though Mr. Benavides himself knew that my client was going to be there. He had my client's contact information. He certainly could have called him. So realistically, what is this proposal? We have not had any contact from an engineer. Other than a phone call from an engineer, do you have any drawings, proposals, specific dates as to when this connection is going to happen? Because I see it still as this dragged on, another 3 months go by until somebody decides that they're finally going to connect.
So I guess to answer your question, the engineer wouldn't necessarily contact you because they're no longer proposing to go through this property. They're proposing to go through the main road, Brandon Road, to make that connection from Brandon Road into the sewer main. And so those plans will be submitted to the Water and Sewer Department. And I told them that they needed to have those submitted next week. So that's the process on our end. But in the meantime, I agree with you that there is an imminent health hazard of discharge to ground surface. And so I'm trying to confirm with you that the property owner who's responsible for the effluent at 5 Brandon Road can send a pump truck up there to rectify that imminent health hazard.
Well, here's the issue, because we have not been notified. And I know you say that we don't need to be notified. That's fine. He does not need our consent or approval to tie into town sewer. I agree. However, I have not heard anything at all in the last 2 weeks. Had he or somebody else contacted myself or my client to say, this is what we're doing next, then certainly with specific time frames, then perhaps a solution can be worked out with respect to pumping. But this 2 weeks go by and there's no response. All I was told was they're considering their options, but I have seen nothing that tells me that he is actually engaging to find a permanent solution. And to me, the continual pumping is just a temporary solution. So until I see some evidence that there is a permanent solution here, then I'm going to reserve judgment.
So I'm telling you that I believe that there is a permanent solution here. The Water and Sewer Department now believes there is a permanent solution here. But what I need to do is gain confirmation that we can take care of the imminent health hazard. And so if I put in effect to tell them you need to have it pumped next week, I want to make sure that that's in line with an approval through your client to make sure that I'm not telling them to do something that you're not allowing them to do.
We had allowed them to do it before with very specific guidelines. So yes, we want it cleaned up as well, but we don't want it to be this ad hoc pumping and then letting 2 months go by and the problem still exists. Truly, this is a daily situation.
There's another solution. There is another solution to this. It's quite easy. Can you hear me clearly?
Yes,
Can you hear my client?
yes.
There's a simple solution to this. It's being done every day of the week. It's a matter of putting a tight tank, okay, on his property, put a sump pump or what they call a sewer ejector on his property, pump it into a tight tank and take it away. It's just as simple as that, okay? To gain access to the piece of property on the corner of Chase and Brandon is not the easiest thing in the world to do. And it would be simplified by him having a tight tank put on that property temporarily. The time frame with the engineer design and working with the town of Dudley Sewer Department, what is the time frame for them to connect? Is the town of Dudley going to open up Brandon Road during the middle of winter?
I can answer that. We have allowed, yes, the sewer department is allowing people to connect. We have other projects that are connecting as we speak. And I spoke to George today, and George has given them the engineer to get him a plan by the beginning of next week at the latest.
And
So
when
you
would-
can review that.
George is the water and sewer commissioner, just so you
That
know
is
who that
correct.
is.
when would construction start on this?
I can't give you that answer. That, once George reviews the plan, then he'll be able to give an idea of when things would start. I can't answer that.
But
I'm not-
from the town of Dudley's perspective, this does need to be expedited, as you're hearing us all say this on the
Right.
record, on a public meeting, that we agree that this needs to be expedited. If I could just respond to your proposal, or I guess suggestion of a tight tank, I do not think that is a feasible solution for any owner to have to put that in. We are trying to come up with a solution that's going to get them a permanent rectification of this scenario, and we're going to tell them that it needs to be done immediately. So the amount of time and money that it would take for them to install that will only take away from the permanent solution. So Attorney Veglier, should I request Mr. Benavides' attorney contact you to work out the best agreement and
He
date?
knows how to contact me both by phone and email.
And should I have him do that so that he can set up that pumping for the imminent health risk right now?
You can have him contact me.
Thank you.
So as I understand it, they are required to provide a design plan by early next week.
That is correct.
So early next week is by Monday, Tuesday, Wednesday? Is there a date given? Is this an order? Has the board issued an order to that effect?
Go ahead, Jamie. Are you talking about the Board of
The Board of Health did not issue an order. The Board of Health issued the order that you already have that says this is an imminent health hazard and it needs to be addressed immediately. The water and sewer commissioner said, get me a plan by the beginning of next week because we want to look at it and get it in while the ground is not frozen and while we can still get this connected. That is the process and progress of where we are at right now.
So can I ask that the Board of Health issue that order as well?
The Board of Health already has an open order on this. I don't feel that there's any reason that the Board of Health would issue another order on it. I think that it makes sense that we continue to put this on our agenda and we continue to assure the progress is being made. But you have two different departments on this meeting telling you that we are expediting our end of things to make this happen.
Pretty much. Jamie, I think the only thing that bugs me on this whole thing or upsets me is 3 months have lapsed of footballing back and forth this scenario. And this should have been addressed immediately in November when you issued the order after October the 30th. Right now, it's costing both parties time and money. And I just want to get it resolved.
I can support
Okay.
that as well.
and-
I would like it to be resolved as well. And I guess my opinion of that is I tried to let both parties work it out together. And come to resolution. You and I spoke about it on site. We've talked about it on a couple of phone calls since. I've spoken to Mr. Benavides' attorney multiple times about it. Like I said, I have a weekly conference call with him. And I've told him that these things need to just move forward now. And that's where I'm at. I don't disagree with you that these things need to happen. The water and sewer department is involved. And I guess the only thing that I can say to you is that we are all of the opinion at this moment in time that the ground is not frozen and that this is the time that it needs to be moved upon so that the ground does not freeze.
My only concern is without deadlines, we all operate on deadlines. We're very good at complying with deadlines, and that's my concern, that we are going to be talking about this a month from now. And 3 months has already passed. 3 months, the ground was soft 3 months ago as well.
But your client was trying to make some form of an agreement and try to make things happen together with the property owner. We talked about it on site that you wanted to try to, work things together. When the first day we met on site, Joe, you said, well, I want to just find a solution of this. I want to get this property sold. I want to move on these things. I want to work with each other. Let's figure this out. Let's get to the other side. I feel like I tried to give you guys that opportunity to do so. And now I told him, if that's not going to be feasible for you, either property to connect through either property through an easement to get onto Chase Ave, I told him you need to move forward and have a septic system installed on your own property. I told him you need to start with soil testing. We need to go down that road. When they hired the engineer came up with this other plan about connecting through Brandon Road.
So when did they hire the engineer?
I don't have a date. I
Okay.
know that I've had contact with him in the last 2 weeks.
Well, Jamie, I can tell you something, and we heard this from the other attorney, point blank, that they hired an engineer to look about putting an on-site septic system on the property. That's the only thing that we were ever told. And that goes back approximately 4 to 5 weeks ago.
Okay.
And it seems like you're not aware of it. I'm just telling you, okay? And I'm a firm believer there is a solution to every problem. But the period of gestation on this at this point in time, 90 days later, okay, I'm worried about this coming into spring. So I think a deadline has to be set, okay? And it has to be set by the Board of Health. If the plans come in front of the water and sewer superintendent next week, it's not going to take a year or a month to approve them. Once they're approved, then someone has to have a threshold of time when the work is going to get done and completed in accordance with the law. Simple.
I can support that once the plans get approved, that there could be a deadline issued for that. My challenge is I don't work for the water or sewer department. If you asked me how long a septic system needed to be, what was a reasonable period of time for a septic system to be installed, I could give you that answer hands down, but I cannot give you that answer as a water and sewer commissioner. I don't have that knowledge base. So I guess I suppose that you could ask this board and myself to work with the water and sewer commissioner to see what a reasonable timeline is and enforce that. That makes sense to me and I would support that, but I can't begin to guess what that is because it's not my field.
I understand. I understand.
So we're asking for the order that you issued October 30th to be enforced, and we're asking you to impose deadlines. Because in my estimation, a septic system could have already been installed on his property in 3 months.
I don't disagree with you, but again, we're going to come back to the fact that your client and Mr. Benavides were trying to work out some solutions. And so I have not been kept abreast of every step of that process, except from from the other attorney's perspective. And so I don't know where your client stands on what you thought was feasible and what isn't. But at this point, enough time has passed that I think we need to move on it. And if it wasn't going to happen through an easement, then I said, find another way. You need to get again, I went with septic system. They proposed something different. I don't really care. as long as it gets resolved and it gets resolved within the law.
We agree with that perspective.
Yeah, totally.
And if it doesn't impact my client, then I certainly agree on it. Just that up until this meeting, we had no information as to which way anybody was going. We were continually told that they are quote unquote considering their options, which to me means they're doing nothing. So it requires action at this point, not consideration.
I apologize for the interruption. That was the superintendent from the sewer department just reconfirming that he did tell them that the plans need to be in by Monday of next week, and he will work through, him and Mike will review the plan and work through as quick as possible. So I apologize for the interruption.
No,
This-
Mike's a great guy.
Ms. Canoyer, do you happen to know what a reasonable time frame for installation is? So if we were to, if this board were to consider a timeline upon approval, so after the approval has occurred from the Water and Sewer Commissioner, installation needed to be expedited within 3 weeks. Is that a reasonable time frame? 4 weeks? Is that I don't know. I can tell you septic. I cannot tell you sewer.
Yes, that's, I'm thinking of the going down. Yeah, because usually I can just tell you for normal circumstances, when we have a house just connecting to the road or even going down, it's only usually within a week it's connected. So something like this might, I don't know the exact, but going that you're going road and road, it might take a little bit longer to lay, but he assures me they're going to do it as quick as possible.
And so if the Board of Health were to consider after approval that the installation needed to occur within 3 weeks and be completed at that time, does that seem like a reasonable request
Yes.
or mandate, maybe is a better way
Yes.
to say it?
Yes. Yep. And the sewer superintendent also said he will keep you updated as to the status, just as a courtesy, like I've received the plan, I'm doing this, I'm doing that. He will keep the Board of Health informed.
So once he's connected to the sewer, the town sewer, what's going to happen as far as the cesspool? Who's going to be required to knock it down or fill it in?
The property owner at 5 Brandon Road, and but you'll have to provide permission to your property in order to allow that to occur.
Okay.
Any other questions or concerns?
Do board members have any comments? I was just going to mention something.
Certainly.
When's the next Board of Health meeting?
Either the 16th or the 23rd. I don't think we have a date set yet.
Yeah, usually we discuss it at the end of a current Board of Health meeting to schedule the next one.
And in case there's a reason why we have to have one sooner or something, be it for usually if
The
we have to have
COVID.
the
We
COVID.
have to be able to maneuver.
Yes.
So prior to the Board of Health meeting, all right, Jamie can continue doing any enforcement that is necessary, but she is the agent.
That's true.
Did you hear?
I did. That's true.
Jamie's in 100% control as far as that is concerned. She's the agent.
So, I think we could probably set the date now for the next Board of Health meeting if you wanted to, board, because then we could have it on our calendar, and Attorney Bigler and her client will have that knowledge if they have interest or need to come back to you.
The 23rd would work better for me
16th.
because that previous week I have meetings every other night.
That might be school vacation. Are any of you planning on shutting off your computer? You can't go anywhere.
You going to Florida?
I wasn't thinking that we could do that yet.
You can, you just can't come back.
Lori or Ro,
Third is better.
23rd is better on my end as well.
How about Ro?
Yeah, I didn't have any plans for school vacation. It's fine.
The 23rd is okay, though?
Yep.
Okay. Jamie, that work for you? Okay. So it'll be the 23rd, February
4:30?
23rd at 4:30.
Is there a way we can get muted off for a second?
Sure.
Can you mute us off from that Zoom for a moment?
I think you have to mute on your end. I don't think we have that authority.
Hang on, let me do it. Hold on.
So Jamie, I will keep you informed when George relays information every step of the way.
Thank you.
No problem.
Okay, we're back on.
Okay. Anything else that you have? Do you have any other questions or anything for us at this time?
No,
We don't.
no. Thank you very much.
Thank
Thanks
you
for
very
coming
much.
on.
So I presume the submittal to the Board of, the Sewer Department is public information?
Once permits have been filed, yes.
Once permits are filed.
Yes.
Okay. So just submitting the plan is not a public document.
Not at this time because it's a plan in process. Until it's approved by George, then yes. But I usually don't
Okay.
get that till I get the permit.
Could I ask that you email me when confirmation that you have received copy of the plan?
Yes, I will. I'm making a note, that's all.
Okay, thank you.
Not a problem. Thank you. Okay, if nothing more, we will move on to our next agenda item then.
Thank you.
Next,
Okay, thank you.
thank you for your
Thank
time and have a
you.
good evening.
Have a good
Thank
night.
you. Take care.
Okay, thank you.
You too. Thank you.
Okay, so up next is COVID update. So who wants to go first? Ro, Jamie, it's up to you.
Ro, it's all you.
Well, you're doing more than I am with the vaccine. So as far as active cases, we have 44.
Very nice.
Yeah,
Wow.
yeah, we came down quite a bit. Still seeing some clusters, but not too many. Kind of, I don't know, I don't want to say any more because I'm probably going to jinx myself, and tomorrow morning I'm going to wake up to huge numbers. So I'm going to leave it at that. Thank you, everyone, for continuing to wash your hands, social distance, wear your masks. Lovely. Hopefully we'll get the vaccines out for everybody and we'll all get vaccinated, and hopefully the Massachusetts will, come out of the red eventually, and the lovely United States won't look so red. We'll all be, white again, and we won't be so afraid to go anywhere anymore, but hopefully. So that's all I have, really.
Okay.
If I say
Thank
too
you.
much, I'll jinx myself and I'll be mad.
Nope, that's okay. We'll take, it's all good.
Right.
Okay. Up next then we'll go to Jamie.
Yeah, so from our perspective, from I guess vaccine rollout perspective, Ro had submitted for there's like 7 steps in the process to become a mass COVID vaccine provider, and so the first major hurdle is the Massachusetts. It's called MIIS, and she's submitted for that, applied for that, approved for that. We also submitted and were approved for the Massachusetts COVID vaccine program. From there, we have to get approval for PrepMod, which is the it's the like interface that works between people that book it when you book your appointments, and then all the way through reporting up to the state. It's the billing, it's everything. Once we get through that, we have to get through an agreement with Commonwealth Medicine to get the actual billing for administration in effect. So we have that ability to bill for administration, but not for the actual vaccine. For anybody that's interested, because it is a federally funded vaccine, there's no billing that is allowed anywhere in the country because it was paid for federally. For our clinics, we did receive notice today that FEMA will pay 100% reimbursement back when we do have those clinics. And so typically they would cover 75%. So the fact that they're covering 100% is a major deal. So that's a good thing. And then further from that, we've partnered with Harrington Hospital to have our residents in town that meet the certain phased approach be able to go up to Harrington Hospital and get their vaccine in a slated and scheduled appointment. Harrington is a public clinic, but we have supported them locally, and they're trying to work with us to help our residents as well. To that end, we're kind of also pursuing other avenues to get this vaccine out once we have access to it. Unfortunately, I was on a call from 3 to 4 with the state where they said Massachusetts has a vaccine supply challenge, is what they're calling it right now. And so if you think about all the people that were eligible in phase 1, Massachusetts has not received enough vaccine to cover half of phase 1 yet. And so we're only getting, as a state, 86,000 doses a week at this point in time, which is not a lot when you think about how far they're trying to spread that across the state. They are trying to set up these mass vaccination sites. They're calling them super sites across Massachusetts. There's one at Gillette. There's one opening at Fenway. There's a couple others. I think they're going to have 6. They did announce today that there's going to be one at UMass. That's one of those super sites. The super sites are going to start at 500 to 1,000 doses a day and hopefully get to 5,000 doses a day. But again, we have to get additional supply in order to do that. There is also one at the Eastfield Mall in Springfield that will be standing up, and they believe that's the end of this week. You probably have also seen that the phase approach, even though we haven't gotten through everybody in phase 1 yet, they have opened up to phase 2 starting February 1st for the 75 plus population. That only means that 75 plus are now eligible. It does not mean that people who are 75 plus should expect to get their vaccine on February 1st. It is going to be a process. If you're booking through Harrington right now, the appointments are not for today or tomorrow. They're for a week or more out. And so just, I guess, be aware of that. These other major sites that are supposed to be opening by the end of the week should have their vaccine appointment availability, hopefully by the end of this week, up so that if people wanted to schedule and pre-register for that, they would have that opportunity. I heard that they were trying to open it up for a month. And so if you were looking to book an appointment at the Eastfield Mall, you should have a full month calendar in front of you, which should give availability for people. So that's one of the ways they're trying to do that. The reason that we're trying to move forward with our vaccination kind of program stand up here in town is because we think it would be beneficial if we could serve populations that don't feel comfortable traveling. And so again, that's probably the same population of seniors, but that's our goal. The vaccine fridge that Roberta ordered is expected the middle of February now. And so if they are willing and able to give us vaccine at the state, we should be hopefully on track to meet that requirement around that middle of the month. Sorry, it's loud in my house at the moment. So the other thing I wanted to say is that local health departments that have been getting this vaccine out to first responders over the past 2 or so weeks and have proven that their systems work, we're told this week that they're only going to be eligible and able to receive 100 doses a week at this point in time. And so even if they requested 300 because they had 300 people ready to go and they were ready to get them vaccinated and they were eligible, they said that because there is a local public health supply chain challenge of vaccine at this point, they're only going to be eligible to get 100 doses at a time. And so that's brought a lot of frustration over the past day or so, because when they announce that seniors are now going to be eligible. They're also telling us there's this challenge with getting the vaccine federally to Massachusetts. So we were told and assured today that they are pushing with everything they have to say that we are capable of taking on more vaccine as a state. And so I think we might have a week to actually see what happens there. And then I guess I also wanted to just mention that there's the form for the COVID-19 vaccine notification form. It does not mean that you have now signed up to get the vaccine. It means that you have said, you've put your name on a list and said that you would like to receive the vaccine. We have, as of this moment right now, 1,333 people that have registered for that or put their name on the list for that. It does give us the ability to reach out to the people that are currently eligible, and those are any of the people in category 1. And so I haven't gotten it to it yet today, but over the weekend I did start calling people and verifying their information and sending people the links of where they can go and get the vaccine at Harrington and or other sites if it's more convenient for them. People were very happy to get these calls. It was kind of a cool thing to do when we've been dealing with the tough pandemic for a year. So but at some point, I'm hoping that we will be able to utilize some of our staff to help us with those calls and verification, and maybe those public health assistants, board health assistants, to be able to get some of this out. I have just a generic message that I send out to them if they do meet the criteria, but I have been calling each one individually to make sure they're eligible because of the fact that a couple of people filled out the form wrong and misread the question, and they thought they were eligible, but they didn't actually meet the eligibility. And a couple of people put themselves in twice by accident. And so I just needed to flesh those kind of parts out a little bit. So I think that the form, I've heard really positive things from people, that they were psyched that there was a place to put their name. And I think that it gives us this ability to kind of work on this. I do find that a couple of our surrounding towns did put something out over the last 24 hours, kind of like an all call for vaccinators. And I don't know if we want to consider as a board if that might make sense for us. I can add it seems, to the end of the form. So as the people fill it out, if they are a vaccinator and they are willing and able to volunteer, it would give us that ability. We do have a pool of vaccinators, obviously, with some school nurses that are willing. Obviously, Roberta is our lead on that. And then we have paramedics that in town have said that they would be willing to do that as well. But it appears that, Charlton put out an all call and had 40 vaccinators step up today willing to volunteer and help us get to the other side of this. So we might want to consider doing that and seeing what you just pull a list together, and we can do things like support Harrington with our vaccinators that are willing to volunteer at that sense, or we could have a list ready to go when we need it. I don't know how you guys feel about that. And I think that's probably everything I have to tell you anyway.
Okay, thank you. What are you, Lori and Ro, what are your thoughts about an all call for vaccinators? Do you think we need to put something out there, or do you think we have enough people who will be there for us when the time comes?
Well, where are the ones who we think are going to be there when the time comes? Where is that list?
Well,
I think we should get a commitment. I think it's worth putting it out. I think people want to help.
Yeah, I mean, it wouldn't hurt. I mean, I can
Absolutely.
definitely talk to my colleagues in the school and see what they say. I know Jamie's been in touch with the fire chief, so we know that they'll help. So, it definitely wouldn't hurt. There are many nurses and PAs and pharmacists in town that would be willing to help. So, yeah, I don't see why. We don't know
Absolutely.
how many we're going to need, but I know for a start how many in my head we have. And then when we get to the point where how many doses we're going to have for how many people we're going to vaccinate, we could go to that. We're going to have it as a backup list, that's totally cool. That's totally fine with me.
Perfect.
Yeah.
Okay.
And I would look at it as a backup list, Roberta, because I do think that we have a pretty robust list in the
Yeah.
context that you have and the paramedics. But I
Yeah.
also think that if we had a list together, we could start feeding them over to Harrington, and the more vaccinators they have, the more they can get out now, which helps
Yeah.
our population.
Okay. I had one question about the form that we put out to, the Google form that you put out, Jamie. I'm concerned about the people who have no computer or internet access at all. Did we have
So-
some sort of paper form at town hall? I might have missed that part.
No, that's okay. I was gonna
Oh,
add
okay,
that in.
okay.
So thank you.
You're
So
welcome.
when the call went out, it said if you do not have access to a computer, you can call 508-949-8036. And there is a message there that says, please leave your name, your number, your address, and someone will call you back within 5 business days to get you on, to help you register
Right.
to be on the list for a vaccine. So the Board of Health assistants are doing that. They are checking the voicemail. They've come up with a spreadsheet where they just have listed what they're doing right now is because I think there's 130 voicemails or roughly something
Yep.
that
Yeah.
Carlos told me.
Yep.
And so they've made up a spreadsheet. He's putting all the information in of all the people. And then tomorrow he's going to finish that. And then Thursday, the 2 Board of Health assistants that are working are just going to call people back, have the form up, fill out the form for them while they're on the phone with them, and explain that they'll get a phone call, or notified when it's time and where to go.
Where was this notification given? Was this-
It went out via rave notification.
On Friday.
Is that
Also on the website.
only? Oh, it is on the website. I thought I was gonna ask.
Yep,
Okay.
and it was on the social media pages and it went out through a press release to the newspapers. So it
Okay.
was very widely spread out, I thought. The numbers started climbing really quickly and it was taking my breath away a little bit, but then it leveled out. So I felt like it was a good push to get an understanding of how many people in town are looking.
Mhm.
And we can absolutely use the Board of Health assistants, Jamie, when it comes time to reach out and, get people to where they need to go. That's what their main priorities is going to be, is the voicemails and getting through all that. And they'll be there to help whenever we need them for any type of, if we set up any vaccination clinics or anything, they can be there as well if their schedules allow. Absolutely.
Is it worth reaching out to the housing authority contact for Joshua Place? Is she aware of, like, maybe of any residents there that she could get a message to if they have no access to, they didn't see it in the paper or they don't have a computer?
Roberta, you have a great repertoire with Lucille, don't you?
I do. I would be happy to reach out to her. Yep.
And if
We all-
she needs anything, we'll be more than happy to work with her.
Yep.
We also had a conversation at one of our emergency meetings that we thought if we were given the opportunity as a town to get vaccines in our hands, we would go out to them, right, Ro, and we'd do a clinic at their site.
Right.
So we just need to understand if the state's going to be able to support us in that or not.
Okay, thank
And
you.
so do we think that the governor's going to come out and say, oh, I'm sorry, we have to slow this down a little bit? We're misinformed a little. Sorry. It's just-
I don't think so. I
he's
think
gonna
this is
come
a
help.
I think this is a political move that they opened it up, and I do think that they are trying to get the word out to the general population that we're only getting 68,000 doses across the state each week. That's not a lot of doses.
Mm-mm.
And if each super site is going to do 5,000, think about, they're going to have 7 super sites. Think about how much of that vaccine just goes to that. So Jana told us today, Jana Ferguson, the assistant commissioner, I want to get this in local health's hands. We're just not there right now. So I kind of feel like as long as we keep moving things along and we're ready to pull the trigger when they tell us we can, then we are doing good by the town. Then we are putting our efforts into where we need to.
Absolutely, I agree. This way, when we finally get it, we'll be good to go, because I don't see a lot of our seniors going to Fenway or Gillette or even, out in Springfield Way, or they're not going to. They're definitely going to be waiting for us to call and say, okay, it's at the Dudley Fire Station. Come on down,
Right. I'll
I will
drive up to Fenway.
I will also say though that one of the efforts they are trying to do is get it out to the doctor's offices
Mhm.
so
I was just gonna
that
say that.
that may satisfy some of the people that have the ability to go in for a doctor's appointment and have access to it through that. It hasn't flushed out yet for me to be able to give you enough detail, but it is something that currently right now the hospitals that have the doses of Pfizer is just so much harder to handle because it's the minus 80 degrees. So the hospitals that have those doses are trying to work with their local physicians' offices
Mhm.
to get it in their hands. And I think that that's, again, I expect in the next week, we're going to hear a lot more like coming out of the woodworks about it all. It's going to be like, hold your breath for a little while, but as long as we keep ticking along, that's what
Yep.
I'm trying to be positive. Yeah.
Right. Jamie, can you talk a little bit about if you heard anything in the meetings last week, this week about the vaccine as far as how quickly the immunity, how quickly a person is immune? I've had a lot of people ask me about that there, and I know that we can't stop masks and we can't stop, the travel order and such. Those things are still in place, but a lot of people are asking about, how soon are you immune? Is it like when you get the flu shot? You can still get the flu, but not as bad a case. How is the vaccine? There's a lot of questions around that, and I haven't heard anything, so I was wondering if you did in the calls.
It's a great question to ask. If you had the vaccine, would it lessen your severity? I don't know
Yeah.
the answer to that.
No, they didn't say anything.
They don't say anything about that.
Okay.
I don't know if they know it. That might be why they don't say anything about it.
Okay.
But when after you get your first vaccine, 7 to 10 days after you get your first vaccine, you have 52% immunity built up, roughly, I guess I should say. And then after you get your second dose, about 7 to 10 days after that, you should have 94 to 96% protection built up. So it's not zero. And so
Mhm.
I guess that's very small percentage. I don't know if that means it's a lesser strength or not. I don't think I've never heard it once mentioned. So
So it does make sense, even if you've had it, the virus, to still get vaccinated, because you're going to have, at least 96% immunity versus those 90 days. So it still
Correct.
is recommended.
It's
Okay.
definitely still recommended, but the only thing that I did hear mentioned is if you had COVID and then you went and got your first vaccine, there's at least people that are reporting. I won't even have to say a high likelihood, but there are people that are reporting, and I know one of them personally, that they had a very significant reaction
Mhm.
to getting that first vaccine, where they had what some people describe as their second reaction when they had their first dose. And that was, they were exhausted, they had headache, they had muscle aches, 12 hours to 14 to 24 hours. And then they
Mm.
were okay after that, which is good because it's your body response, it's an immune system building up and everything, but it's difficult 24 hours to go through if you have that experience. And the way that the state epidemiologist described that was, if you think about it, when you get your first vaccine, that's your first introduction to your body's way of fighting it. In that case, if you've already had COVID, that was your body's first introduction to fighting COVID. And when you get the first vaccine, it's essentially the second exposure your body has had to fighting it. And so it may more mirror what your second vaccine looks like.
Nothing like reliving those symptoms.
No. All right, so if nothing else from the health agent and nothing else from the nurse, Lori, do you have anything?
No, I was just looking over some notes I jotted down. Jamie, you've been great, and Roberta, thank you for all your hard work and information. And okay, I'm good.
I just want to remind people that you can go to the Town of Dudley website. Right on the top, there's a flyer of what do you call that?
Banner.
Banner.
Let's
That's
call it
the
a
word.
banner.
Come
That's the
on,
word I'm
Jen.
looking for, a banner, and you just click on there, and it's very easy to do. And just remember that you are registering to get on a list to be notified when the vaccine is available. And then you'll be contacted as to when you can go, where you can go to, excuse me, not when you can go, where you can go to sign up to make your date and things. So just a reminder of that. And if you don't have access, again, the number you can call is 508-949-8036. And someone will get back to you within 5 business days. So, you know, and we're going to be there, and hopefully once the ability is there for us, we will get out and help as many people as possible. That's what we're here for. So, and yeah, Jamie and Ro, kudos. I mean, I give you guys a lot of credit. It's been,
Wonder Women.
oh my goodness.
Yeah,
Oh, I have my Wonder Woman RN sweatshirt on today. How
All
appropriate.
right.
Yeah, how about
You must have
that?
known.
I used to tell people I couldn't wait to go on vacation. Now I say I just can't wait to go to sleep. Like I just want to go to sleep.
yeah, I'm sure. Oh my
Insomnia and
God.
I are best friends. When I get up in the middle of the night, I'm like, what can I do now? Who cares if it's 2 o'clock in the morning? Doesn't stop.
You can
I
call
do have
Jamie.
a question.
Pass away.
Just about, I've had clients reach out. Should they still continue to contact their physician, and if they, to see if their physician has access before the town? And do they need to remove themselves from the list if they do end up getting the vaccination through their physician?
I'll answer that. Nobody has to remove themselves from the list. If I
Okay.
send you another message and we call you and say, hey, it's available, and you say, I already got it, we're going
Okay.
to say, wonderful, we're glad you're protected.
Okay.
But if they have access to it in any other means, then we would love them to get it when they're
Okay.
eligible, because we want to be protecting as many people as we can, as fast as we can.
I advised, it doesn't hurt, check with your doctor if you can get it faster through them, because we didn't have an exact date for when our timeline, you know, where we were going to have our hands on it. So, all right, I just wanted to double check.
And if
Don't
they're
wanna
only
give
giving us
incorrect
100 doses, you should tell them to still call their doctors.
Oh, yeah, yeah, definitely, definitely. All right, thank you.
All right. I have nothing else. I think we've covered everything we need to.
Okay,
So I'll entertain a motion.
I will make a motion to adjourn today's meeting. Lori
Second.
Ducharme.
Roberta Johnson, I second that.
I have a motion and a second. No other discussion. Seeing no other discussion. All in favor, roll call vote, please.
Roberta Johnson, I.
Lori Ducharme, aye.
Jen Canoyer, aye. Meeting adjourned at 5:32. And Michelle, you just have to stop the recording and take us off of you. Please.
Hold on.